Attention Gen Z, are you experiencing back pain? I'm an orthopedic spine surgeon. My name is Dr. Deptee Jain, and I treat hundreds and thousands of patients every single year with back pain. And a lot of those patients are patients in your age demographic. They are teenagers, they're young adults experiencing low back pain. So if you're one of those people, this video is for you. So what causes low back pain in patients of your age population? So there are a number of different things that we see commonly as spine surgeons. So one thing is, for example, lumbar disc herniations. So lumbar disc herniations occur at any age, but they tend to predominantly occur between the ages of 20 and 40. I do see patients, however, who are much younger, example, teenagers or older teenagers, young adults, who also experience lumbar disc herniations. So lumbar disc herniations can present with severe back pain, and oftentimes that back pain is radiating down to the buttock or to the legs. And that's because there potentially could be a pinched nerve. When a disc herniates, the nerve can get pinched. So that's a very common cause of back pain in the younger population. Another really common cause of back pain in this younger population is what is called Isthmic spondylolisthesis. Now that's a really big word. But basically what that means is that there's a little deficit in the bone in the back of the spine called the pars. Most frequently, this is at L5-S1, but it can be at different levels as well. If you do have isthmic spondylolisthesis, for example, there are certain sports that contribute to that condition. So for example, gymnastics. We know that any sort of sport where you're hyperextending your spine, where you're bending back, can actually put increased pressure onto that bone, and that can be a risk factor for this pars deficit or this isthmic spondylolisthesis. Or for lumbar disc herniation, we see increased rates of lumbar disc herniation in people who play baseball, for example. But by and large, physical activity is good for spine health. When young adults have isthmic spondylolisthesis, what ends up happening is because of that deficit in the bone shifts a little bit and the spine becomes unstable. That can be a source of back pain, number one. It can also be a source of, again, buttock pain or leg pain, because when the spine moves in a way that's slightly abnormal, the nerve can actually get pinched, and that can cause the pain to radiate down to the legs. Another cause that I frequently see as a source of back pain, again in the younger population, is scoliosis. So scoliosis has a number of different etiologies or causes. A very common cause is what we call adolescent idiopathic scoliosis, meaning we don't know why someone develops scoliosis. It's idiopathic. That's the meaning of the word idiopathic. And for whatever reason, I tend to see some patients who have scoliosis and they have some increased back pain that might or might not be related to that scoliosis. Those are the most common causes of back pain in the younger population.